Pavel's going to speak about the programs for children of essential workers that they've instituted. Pavel?
Thank you. Hello, everyone. My name is Pavel. I'm 26 years old, and I'm part of the MAKOM artist community here in Nahariya. I'm very happy to be here, and I'm very happy you all joined in. I was born and raised in Akko, right here in the Northern Galilee. I'm living a 10 minutes drive from the city I was raised in. My parents immigrated here in '92 from the former Soviet Union. In the past 3 years, I've been living here in Nahariya, part of this MAKOM artist community. I'm studying in a special program that involves both art studies and community engagement. On a daily basis, I'm working as an art teacher in a school here in the area, in a program that integrates children of immigrants from the former Soviet Union through art. And I'm also the coordinator of our volunteer program. My MAKOM community is part of 5 MAKOM communities all over Israel. We have over 250 artists taking part in those communities. On a daily basis, we all work as art teachers at schools, and we are socially, we're working as art teachers at schools, and we're taking part in various programs in our communities, trying to build and strengthen the local communities and make and create and do art in the places that we are in. I think that my story could help you a little bit understand. I was born and raised in Akko. My normal path would be to live here and go to Tel Aviv in order to be an artist. Today I live in Nahariya, and my community creates here and gives an opportunity for people to do and continue making art, making local cultures in the places that they live in. And it's a very special thing here, and I think everywhere around the world. So during this crisis, we were asked by both the Nahariya Western Galilee Hospital and by the Rambam Hospital to help with opening a daycare for the essential workers and practically the people who work in the hospitals during this time. We have over 120 children in both of these daycares. The hospital in Nahariya in the Western Galilee is one of the biggest hospitals in the north. Actually, it's the second in size, and it provides medical services for all the people in the Western Galilee. The second hospital that we are taking part in and collaborating in order to create this day camp is a hospital. The Rambam Hospital is the biggest hospital in the north that provides medical care for people that live in Haifa and its surrounding areas. So during this time, we are meeting the children on a daily basis and trying to keep their daily routine and trying to help their parents. I don't know if you know, but essential people who are working in the medical system here are working a 12-hour shift. Everybody's working 12 hours in a row. They're having a 12-hour break. During this time, the grandparents are not there in order to help. I've had a couple of single mothers working at a hospital who had no one to take care for their children during the time that they're at the hospital and doing what's need to be done during this time. I'd like to tell you a little story. The other day I was walking with one of the children. His name is Gad. He's 5 years old. His father is a doctor at the hospital. And he asked me to hold hands. And I told him that we cannot. And he asked me why. I told him that we can't hold hands because we are handling and trying to deal now with the coronavirus. And we're trying to touch each other less. And he looked at me and then he said, then can we hug? And I told him, no, we can't hug because we're not hugging right now because of the coronavirus. And this moment for me, it was a big moment in order to understand how important and essential what we're doing and how much help in making sense of this new reality these children need. They are trying to handle both the coronavirus, a situation where many activities that before that was normal, good activities like playing outside, meeting with friends, hugging, holding hands, now become activities that they need to be afraid of and might even be dangerous for others. And their parents are working at a hospital and they're trying to make sense of a situation where their parents have to work more, handling more stress. And we are trying to do the best we can to help them and help their parents do their job in the best way they can. I think that would be it. Thank you.
Thank you so much, Pavel. That story is both heartbreaking and inspiring at the same time because of the work that you're doing, really helping these children create a new normal and understand their world at their level in a completely different way. So really wonderful to understand what your community is doing, and both hospitals are huge hospitals, and the Western Galilee Hospital is essential, not just for the Western Galilee, but for really the very north of Israel. So thank you so much for that.